These are my notes, and this is my audience members.
Hi, I'm Linda.
Hi, I'm Michael.
I'm Shanice.
All right. The brain is an amazing organ in the way it works and develops. You can walk and talk because of your brain. Your brain is what gives you ideas and decisions. Have you ever wondered what a rare condition of the brain is like? In my research, I will be educating you about what polymicrogyra is, how it affects the brain, and how is it diagnosed and treated. So what is polymicrogyra? Polymicrogyra is a condition characterized by abnormal development of the brain before birth. Specifically, the surface of the brain develops too many folds which are unusually small. Charles James stated in his book, Pediatric Radiology Case Base, that neural migration disorders are characterized by dysmorphic gray matter, which signal generally iso-intense to more normal appearing gray matter. Gray matter is the type of tissue in the brain that serves to process information, which means more normal amounts of gray matter can cause developmental issues. Charles James also wrote that it can affect speech, vision, and physical movements. According to the studies, polymicrogyra is a malformation that affects the brain. HealthJade team stated in their research that the signs and symptoms associated with the condition vary based on how much the brain and which areas of the brain are affected. However, affected people may experience recurrent seizures, delayed development, crossed eyes, problems with speech and swallowing, muscle weakness, and sometimes paralysis. Bilateral forms affecting both sides of the brain tend to, tend to cause more severe neurological problems. Polymicrogyra can result from both genetic and environmental causes. It may occur as an isolated finding or part of a syndrome. Treatment is based on the signs and symptoms present in each person. According to the book Human Malfunctions and Related Anomalies, Roger Stevenson said, polymicrogyra is often bilateral and clinically present independent upon the extent and location of polymicrogyra and the effect of any associated intracranial anomalies. Distant distributions of bilateral polymicrogyra are recognized and may guide clinical prediction and genetic testing. Genetic specialists can determine whether it is bilateral or not. Stevenson talks about getting tests done specifically on polymicrogyra and affecting the patient. Polymicrogyra has different categories. More treatment and testing would be needed to find exact genes. Krish MD stated in her research that autosomal recessive conditions are traits or disorders that occur when two copies of abnormal genes have been inherited on a non-sex chromosome. If both parents have autosomal recessive condition, there is a 100% likelihood of passing on the mutated genes to their children. HealthJade team also had recent studies by experts that deemed the term polymicrogyra to refer to several different development disorders or birth defects of the brain that all have irregular appearance in the brain surface that are in common. HealthJade also states, while all are rare, almost 50 genes have been associated with polymicrogyra or polymicrogyra-like malformations, which fall into several groups. Processing of identifying polymicrogyra through MRIs. Oliver Dulick et al. Pediatric Neurology Part Elsevier 2013 stated in their research that causal factors of polymicrogyra are human population-based epidemiological studies and neuroimaging. The MRI can determine what effect polymicrogyra has on the brain. The images can show if polymicrogyria is lateral or bilateral. Treatment would include occupational therapy, physical therapy, speech therapy, neurologist, genetics, endocrinologist, etc. HealthJade states pediatricians, neurologists, surgeons, physical therapists, and others may need to systematically and comprehensively plan on affected child's treatment. Patients usually will need multiple specialists and therapists. In conclusion, polymicrogyria is a rare disease. It can affect either one side or both sides of the brain. Testing, therapy, and specialists are all the forms of treatment. MRIs will show you how much the brain is affected. Development issues, vision impairment, seizures, and even paralysis are symptoms of polymicrogyria. It can be a genetic mutation or even a malformation of the non-sex chromosomes. As research continues, we slowly learn more about this rare disease. Thank you.